Welcome to the Fitness Doctor on ESPN 730, the program where we address your exercise, nutrition, and overall health needs. My name is Aaron Cannady, and now an exercise physiologist in the School of Sports Sciences at Wingate University, the Fitness Doctor, John Acquaviva.
I like the every single time. Thank you, Aaron. Today our topic is chiropractic health. I think a lot of people know the term spine adjustment as a result of this form of health, but today we're going to go a little deeper into this profession and discuss a little bit about the history, the purpose, and how they treat and prevent common injuries. Before we move on, Aaron, what's in store for us today?
This segment's rundown includes in-studio guest John Rosano, quick Q&A with Dr. A, social media breakdown, and fitness nuts in the news.
Awesome, Aaron. Thank you. My special guest today is John Rosano, a doctor of chiropractic, a chiropractor since 2001, an owner of Rosano Chiropractic in Monroe since 2003, and I bet he at least has one good Italian recipe. So, John, if we have time, we'll talk about that. Welcome and thanks for being here.
Thank you, sir.
Now, John, we have a lot to talk about this week and next week. You're going to be our guest next week as well. But to get us started, how did you get into this? Why did you become a chiropractor?
I became a chiropractor when I was 31, had an automobile accident.
Got it.
Totaled the car, basically totaled me.
What were you doing professionally at the time?
I was in retail.
Got it.
I was a retail manager for a Disney store.
Got it.
And on my way to the office...
This is a natural segue. I think a lot of people in Disney go into chiropractic.
Oh, must be. You got to be nice, right? But that's what happened is I, had totaled my car, totaled my body.
Yeah.
Had herniated a disc.
As a result of the accident?
As a result of the accident, had surgery.
Got it.
It was terrific. A year later, my problems came back. And so when I went back to try to figure out really what the problem was, it was a spinal injury. And nobody seemed to help. My mom was a nurse. I grew up, Mom, I was sick. She gave me a pill.
Yep.
So I didn't know anything about chiropractic. Somebody that I worked with told me to go to a chiropractor. I went. It was really a life-changing experience.
Awesome.
And so at 37, I went back to school to become a chiropractor.
Good for you. And so about 13 years now you've been a chiropractor.
Yes, sir.
Well, good stuff. We're going to talk about what you learned in those 13 years and your philosophy and a whole bunch of other stuff. But before we do, Aaron, social media breakdown.
If you have a question regarding chiropractic health or like to request a future topic, follow us on Twitter at WU Fitness Doctor. That's all one word. Or like our page on Facebook at Woo Fitness Doctor, or you can always shoot us an email at wufitnessdoctor@wingate.edu.
The bell.
And now, segment called the Quick Q&A with Dr. A. This is where I shoot a couple of questions at the doc to get us specifically rolling on today's topic. Doc, are you ready?
I'm ready.
Question number 1. How long have chiropractors been around?
Oh, we start with an easy one. I love it. Right around the latter part of the previous century, right around 1890, so right around the turn of the century, so it's a little more than 100 years old, chiropractic.
Question number 2, do they go to special schools?
Yeah, I think this is referring to, do they go to the same schools as the traditional MD? And the answer is no. They have special schools for chiropractic, and they're all over the country. And but yes, they are special schools.
Question number 3. Why do chiropractors get a bad rap?
I think for a couple reasons. I think the first one is that there's a certain level of, for lack of a better word, ignorance on the public's part. But I think the other thing is because they believe that the only thing that chiropractors do is what's called a spine adjustment. In other words, they crack their back. And I think the person thinks that the chiropractor thinks that will solve all of their medical issues. So I think it's a little combination of, I think in some way or the other, it's just lack of education.
All right, that's the quick Q&A of the day. Now, back to the doc.
Okay, Doc, before we start talking, a couple statistics here. There's over 40,000 chiropractors in virtually every city in town across America, but yet very few people know a lot about this. Would you say that you part of your job is probably educating people, isn't it?
Well, that's really, Latin doctor means teacher.
Got it.
So that's what I do every day, and I would totally agree with you. I think the need for chiropractic is much, utilization is much greater than it is, and it's really just through ignorance. You know, people just don't really understand, gosh, when do I go to see a chiropractor versus when do I go see my medical doctor?
Okay, so this leads us to our first question. What are the two biggest myths that you fight against, that you have to explain And maybe part of it is what I said in the quick Q&A, right? That a lot of people think that all you do and what you do is a spine adjustment. Are there other terms for that, by the way? Spine adjustment?
Subluxation is a subluxation to me as a chiropractor would be the same thing as a cavity to a dentist.
Got it.
You know, I go, when I look at a patient and I'm putting my hands on my patient, I am looking for and identifying areas of subluxation, of areas that do not move correctly.
Got it. As they should, as the body is designed to move, right?
Yes, sir.
In particular, the vertebrae, the disc is in between the vertebrae and so forth.
As a chiropractor, I'm a joint doctor. So not only am I aligning the spine, but knees, hips, elbows, you know, I'm a joint doctor.
Now, by the way, the joint doctor has a completely different meaning in places like Colorado where they've legalized marijuana.
Yes. That would be your local guy in the corner.
Okay, so let's go back to the original question of two biggest myths.
I would say one would be, first of all, people don't understand really how to use it.
How to use
chiropractic.
Got it.
So they really, they're uncertain on where to go and who to see. And the second is, I would say, is that a lot of people think once you start with chiropractic, it seems like the idea is out there that once you start, you always have to go to a chiropractor.
I would agree with that. In fact, I think a lot of people do think that. I think that's a good myth.
And I think that is really, again, ignorance.
Yeah.
You know, I would tell you that once you start chiropractic care, it makes you feel so good that's why people return. Yeah. You know, I mean, if you said we've been in the marketplace for over 100 years, but the American Medical Association really has a hard time with us.
Yeah.
So really, it's the people. It's everybody else that has kept us alive.
Got it.
Everybody knows they feel better when they get an adjustment.
Yeah. Okay, Doc. Explain the differences between a chiropractor and a medical doctor, a traditional Western trained medical doctor.
I would tell you the first thing that would be, you have to realize that a chiropractor is a biomechanical doctor, right? I am the body mechanic of the healthcare team. So if you have, let's say you have an infection, you wouldn't really come to see me. You know, you would go to the medical doctor for an antibiotic. You would go to the medical doctor if you have diabetes and you've got to have blood controlled or your sugar controlled.
Yep.
You know, that's when you get medicine from your medical doctor.
Yeah.
In terms of a chiropractor, I really am the guy that keeps you aligned. So think of you as if your body, you're driving down the street and you hit that pothole, you know, you're going to be thrown out of normal alignment. When that happens, that puts pressure on a nerve that's coming off your spine, which causes a symptom.
Yep.
I think the best thing we would be able to do is to recognize, hey, this is a symptom, and now how do I take care of it?
Got it. Okay, just a little bit of anatomy. That way people can kind of understand what you guys do and why the biomechanics, how that ties in here. Okay, we have our brain, which is part of the central nervous system, and then
the spinal cord.
Yep, and then from the brain comes the spinal cord. It's literally attached.
It's really the tail of the brain.
Yep.
If you can think of
that's a good way to put it.
And just the tail, the brain is the tail, or I'm sorry, the spinal cord is the tail of the brain. The spinal cord travels down 24 vertebrae, bones, and there's a hole in each one of these vertebrae, and that's where the spinal cord travels.
Yep.
As it travels, at each level, it shoots out a nerve to the right and to the left.
Or a set of nerves, right?
Set of nerves.
And then it branches off, and then it goes into our shoulder, our neck, our arms, down to our legs and so forth.
If we're talking central nervous system, we're really talking brain and spinal cord. When we get to the peripheral nervous system, that's from that nerve going out.
Yeah.
At each level, that nerve has been identified, numbered, and we know where that nerve goes to.
Exactly.
We know what the nerve does.
Yeah.
And therefore, if the nerve is not conducting properly, we also know the symptoms that are also related to that nerve.
Got it.
So when a patient comes into me and they say, hey, I've got this, this, and this, and I've got a problem in my low back, that really keys me into, well, let's look at that particular nerve area and see what's happening.
Yep.
You take an x-ray, you see that there's a curvature there. Well, gosh, there's a pinched nerve there. You remove the pinch, you take the pressure off the nerve, the symptoms go away.
Okay.
You correct the spine, that's the problem.
That's the heart.
That's the heart of it. You know, the trick with chiropractic, and I would say this is also kind of falls into ignorance. It's how do you use a chiropractor? Can we talk about that right now?
And why don't we do this? We're going to do a special segment, and then after the break, we'll come right back and talk a little bit more about this. Aaron, what do we got now?
We have Fitness Nuts in the News, the segment where I found something crazy or someone nutty or crazy in the world of fitness and nutrition.
Now, we've been hearing a lot from the people in Charlotte as well as Asheville, and apparently this is their favorite segment of the show, so you're going to knock them dead, I can tell.
And I cannot disappoint them.
Okay, very good. So I know there's pressure.
It's pressure, but I'm accepting it. I have Rich Froning. He is the 4-time defending champion of the CrossFit Games. And for y'all who don't know, CrossFit Games is the world's premier test to find the fittest people on earth. So everybody in the competition is pretty nutty.
And by the way, half of them who go see people like John Rosano.
I'm pretty sure that. I mean, his maxes are he deadlifts 545 pounds and clean and jerks 370, and he's only 5'9".
Let's explain what a deadlift is. It's when the bar's on the ground,
yes.
They bend over, carrying it or gripping it with both hands, usually with one is a pronated grip, one is a
overhead, underhand.
Yeah. Overhand, underhand grip, and then they just lift it off the ground by basically straightening out their back.
I've seen personally in the weight room a lot of people's backs get
I can see exactly how this creates
inexperienced lifting. So.
Yeah, there's jobs created every day with that stuff.
Yeah, at a couple events, just to show how crazy this CrossFit Games are, there's an event called The Beach where you have to swim 250 yards, do 50 kettlebell thrusters at 24 pounds, do 30 burpees or squat thrusts, swim another 500 yards, do 30 burpees, 50 kettle thrusters, and then swim another 250 yards.
Wow. So there's a lot of aerobic in here, unlike people would think. Because I think when people think of CrossFit and this type of working out, what's called high-intensity training, I think they think mainly about weight training and some type of resistance training. There's a lot of cardio here.
Every muscle, every part of the body.
For you and I to, for instance, run 500 yards, it's not that big of a deal. For you and I to swim 500 yards, that's a big deal.
It's a very big deal.
And this guy, the question is, how many times has he had to go see a chiropractor in the last?
I have not, but he works out multiple times a day, 3 or 4 times a week. So I'm pretty sure his chiropractor is making pretty good money.
And also, we want to know how many calories he takes. Remember, who was the fitness nut of the week a couple weeks ago? He took in 10,000 calories a day.
That was Michael Phelps.
No, was it Phelps? No, I thought it was an offensive lineman or somebody.
Oh, no, he said he takes around 6,000, 8,000 calories.
Oh, that's nothing compared to Phelps.
Michael Phelps said he takes around 8 to 10,000.
8 to 10,000, yeah. So it'd be interesting to see how many that guy takes in. That's good stuff. Fitness nut in the news. And again, this guy's name?
Rich Froning.
Now, just because he wins doesn't mean he's the only nut. In fact, everybody else in that competition.
That's how I feel. Everybody in the competition.
Everybody else in that competition.
It's not for the faint-hearted.
No, literally or figuratively, is it?
No. Okay,
we're talking with Dr. John Rosano. He's a chiropractor in Monroe, and he's been one for about 14 years. He's got a lot of experience. Not only has he had a lot of experience in his field, but he's actually been on the radio before, and you guys can tell it by his voice. So if I'm ever out sick, Aaron, I think he's going to be able to take my...
a very good replacement.
Yeah. Okay, we're going to have to go to break right now. Stay with us here on The Fitness Doctor on ESPN 730. We'll be right back after this message.
Planning your next step in life? Come complete your education in a dynamic, caring environment at Wingate University. Enrollment and construction have skyrocketed in the past 2 decades as students pursue challenging and rewarding degrees in fields like the health sciences, business, and education. U.S. News & World Report has named Wingate University the 6th best value in the South. Visit one of our 3 great campuses, Wingate, North Carolina, Hendersonville, or Charlotte, or check us out at wingate.edu. Major in a great life at Wingate University.
Hi, and welcome back to The Fitness Doctor, the program where we address your exercise, nutrition, overall health needs. I'm Dr. John Acquaviva, an exercise physiologist in the School of Sports Sciences at Wingate University. Aaron, what do we have for this segment?
This segment's rundown includes special in-studio guest John Rosano, more on why we should exercise. More on chiropractic health, the social media breakdown, and the takeaway.
Good stuff. Let's get back to it. Okay, we're discussing chiropractic health with Dr. John Rosano. He's a chiropractor in Monroe and has been in this area for about 10 years now. And the first part of the show, John, help me out here. We discussed a couple things. First of all, how you got into it and why you got into it. You had an injury, and injury to the back in particular, and somebody asked you to go to a chiropractor, and you're like, this is a pretty neat form of medicine or form of corrective health, and so I'm going to get into this. And we also talked about some of the myths that's associated with it. And then you mentioned the word subluxation, which is kind of your term for a spine adjustment, which is a really common corrective procedure. Is it a procedure?
It's a treatment.
Okay, form of treatment.
I am my job What I'm held responsible for is when you come in, as I'm looking at your spine, my job is to remove the subluxation.
Yep.
So that nerve then functions correctly, and then bring the spine back to normal alignment, and then build muscle to hold that into place, and then we're good.
Got it. To support that area.
Support that area.
Yeah.
And just to kind of piggyback on what you had said, Aaron, you know, all these sports guys, what sports team does not have a chiropractor on staff?
Now, is that rhetorical?
I'm telling you, that's why these guys function at the rate they do, because they have a chiropractor on staff who is keeping their spine aligned, so therefore the central nervous system is working at the optimum rate.
I'm pretty sure it's required now I don't know if it's required to have a chiropractor, but it's required now in the NFL to have like a licensed registered MD. Yeah. Or like on the sidelines.
Do you know, John? Do you know that for sure? That virtually every major sport, so in other words, hockey, basketball,
everybody's got one.
They have a chiropractor on staff.
Yes, sir.
Interesting. No exceptions as far as you know.
Not as far as I know.
You got to get that gig.
It's not my cup of tea.
No worries.
I tend to.
You want them to come to you.
Well, I like older patients. I like pregnant ladies as patients. I like kids as patients. I don't necessarily think a 300-pound dude
who takes in 8,000 calories a day is
going to be my cup of tea.
Got it.
But you know what? There are chiropractors that treat that.
Yeah.
So, you know, we had talked earlier about how do you refer? Do you know doctors refer? Do you refer to doctors? Yes. And do you? I also refer to other chiropractors. Got it. You know, there's some patients that walk into my office. I know it's a chiropractic problem. Yep. But it's something that it's not for me. Got it. So I send that patient to the correct chiropractor.
Got it. I want to talk a little bit more about that. All right, Aaron, what is that question for Dr. Rosano?
It's from the Twitter handle, The Fresh Prince, and he asks, why does the spine make a popping sound when it's adjusted or when I bend over?
It's a great question, isn't it?
It's an excellent question. When that popping sound, you're really opening up the range of motion in that joint. So in the morning, I know it was part of my exercise routine. I move my body and I open up all those joints and I'm popping them open. Adhesions occur when a joint is left at rest. It's going to kind of get stuck. So you open that up. When you open it up, you hear a popping noise.
And you basically force out gas or air, right?
Well,
it's pressurized.
During an adjustment, if you hear a popping noise, that's really the hydrogen release out of the synovium, which is the grease in a joint.
Got it. All right, and this is common. In fact, this is analogous to, or it's actually happening in another place of our body all the time when people crack their knuckles, correct?
Same thing.
Yeah, same thing. However, it's a lot more difficult to do, and you don't really want to do it by yourself in your spine, right?
I cannot treat myself as a chiropractor.
You cannot do that.
I can't. I mean, I don't have.
But you can't crack your own knuckles, though, right?
I could crack my own knuckles if I wanted to. But yeah, I can't. You know, you really because you have to have someone to hold your spine in one location and treat it in the other.
Okay, you mentioned earlier, in fact, just a couple minutes ago, that in some cases you not only refer your patients to MDs, but you will refer your patients to other chiropractors.
Certainly.
Right? So give us some examples on where and when, I should say, you would refer somebody to a medical doctor. So somebody comes in, can you think of a recent example?
Yes, I do a free consultation in my office.
Got it.
Okay, so that...
I like that free. Write that down, Aaron. We can go in there.
That's important because a lot of people don't know how to use me, right? They don't know. So I say, come on in, tell me what your problem is. I've had a man come in and tell me he was having heart palpitations. Yep. I sent him into the ER. Right? No. He's not going to have a heart attack in my office. Okay? So, but that's where...
Because you had a golf game to go to later that day, right? And you're like,
no,
this
but,
guy...
I mean, and I had a young lady, her mama brought her in, and she said, I want you to look at my daughter's foot.
Yep.
The girl had a corn on her toe.
Got it.
So I sent her to CVS.
Podiatrist, yeah.
Right? No. CVS. Get CVS. Compound W.
Even
right?
better. Even better. Go to Rite Aid.
Right. You know, I mean, come on. But there are, but patients come in and they sit down and they say, okay, these are my, these are my symptoms. Once I hear the symptoms and you can correlate some kind of problem and you do the exam and you see that there's some immobile areas, then you can say, I think I got a working diagnosis here. And then that's when you then either treat or let's say that patient, I had a patient earlier last week that came in, a young lady, 14-year-old, scoliosis in the spine, had seen 2 doctors in her previous town of Baltimore, here now, went to treat her, she didn't move.
What do you mean she didn't move?
She didn't. She was very her hip, her right hip was the problem.
Got it.
And when I went to bring movement back into that right hip, it would not move. It did not open up. Okay. Fear, I think, was part of it. It was a young lady.
Yep.
And I talked to the mom, and the mom had never even heard that at 14 that you could correct the scoliosis. And the mom just kind of sat there and said, "Gosh, I had been to 2 chiropractors. They never even talked about correction." So chiropractors all, have different ways about what they do too.
Yeah. Okay.
So that was the reason why I sent that patient to another chiropractor, because I knew it was a chiropractic problem, but she wasn't moving for me, so she might move for somebody else.
And why would she move for somebody else? Like, what did that chiropractor? No, you sent her to somebody in particular, right? A friend or a colleague?
I sent her to the doctor who normally treats me.
Got it. And
because I know he treats with a firmer adjustment than I do.
And ultimately, you think that you felt strongly that he would be able to correct her scoliosis.
Well, I think scoliosis can be corrected at age 14.
Got it.
I felt he had a better chance of moving her better than I could, just because for whatever reason we didn't click.
Got it. Okay, folks, if you're just joining us, this is ESPN 730. I'm Dr. John Acquaviva. You're listening to The Fitness Doctor. That's the voice of Dr. John Rosano. He's a chiropractor in the city of Monroe, right down the street from where we are recording here in Charlotte. And we're talking about all things chiropractic. Now, John, let's talk a little bit more about that. Tell me some instances where people think that you should go to a medical doctor. They traditionally go to a medical doctor, but the world of chiropractic says, no, this is what we specialize in. So other than subluxation or spine adjustment.
I would tell you the last 4 patients I've had this week have all been sciatica patients. Okay, sciatica, the sciatic nerve runs down the backside of your leg.
Yep.
It's comprised of 5 nerves, the L4, L5, which are the 2 lowest ones, and then 3 sacral nerves.
Yep.
Well, when those nerves are irritated, you're going to get pain in the low back, into the hip, and down 1 leg or 2 legs.
Have you ever had this, by the way?
Absolutely.
So you can relate to that.
I've had a bulge disc, a herniated disc. I've had back surgery. I am very familiar with all my patient symptoms.
So it's like the commercial. You're not only a chiropractor, but you play one on TV and radio.
That's right.
And you've experienced all this stuff.
So, that really helps, though, is when a patient comes in, many times they're afraid. They don't know what the problem is. And if I can say, gosh, this is what I think it is. This is what happened to me.
Yeah.
You've got the same symptoms, and you can really relieve some patients' turmoil, right?
Yeah.
But a lot of times a patient will go, the first thing they're going to do is they're going to go to their medical doctor. Medical doctor typically is going to give pain relief and some muscle relaxers.
And some NSAIDs, right? Some non-steroidal anti-inflammatory, right? Because that's general, right? Yes. Because in fairness,
typically that's the pain relief.
True. But also there's some legitimacy in that the piriformis muscle, among others, is probably pinching that sciatic nerve, and if they can get that swelling down or it to not, right?
Well, the sciatic nerve pierces through the piriformis muscle.
Yeah.
Okay.
Which is a really small muscle in the area of the butt. Basically, It's in the inner butt.
I don't find that is usually the number one cause, the piriformis muscle. If I do find that that's the cause, after I treat the hard tissue, which is the joint, usually you get some resolve. If you have anything that's lingering, I usually then send my patient to the massage therapist.
Got it.
Who's in my office. She cleans up what she needs to do, and then I follow back up, clean up the rest of the hard tissue, and away we go.
Let me ask this. My brother-in-law, in fact, said he suffered from sciatica.
Yes, sir.
He believes in his chiropractor thoroughly, and he said, "Oh yeah, John, I went to go see him, and he put some pressure with his thumb on my back, and it was done." And I remember we got cut off in the conversation. Something happened. I think somebody said lunch is ready or something like that, and we got cut off. But he claimed that that's all that took. Now, do you know what he's talking about?
Well, so I think what
can
you're
you
asking,
do that? The sciatica is it's a major issue, right? This causes a lot of discomfort in people, a lot of pain. People, they lose mobility and so forth. And a thumb, pressing somebody's thumb in his back.
Well, first of all,
that's a magic thumb, doctor.
But yes, doctor, what you have to realize though is every patient comes to the office with a different set of circumstances.
Yeah, sure.
Right? I bet you this particular guy, your brother-in-law.
Yeah.
Okay. He probably injured it very easy. If something happened, click.
He's in
it
CrossFit,
moved.
by the way, so that
There
helps
you
explain
go.
it. Yeah.
So we did something. He responded very quickly to it.
Yeah.
So therefore, there was no degenerative processes happening.
Got it.
So gosh, that's going to heal real quick. But if you're someone who puts off going to the doctor and allows something to fester, and then you've got degeneration going on, and then you come in and you go, well, how long has this been going on? Well, I've been having pain like this for 10 years. Well, okay now. So it's going to take a little bit longer to treat that.
Got it.
Age also has a factor. The younger we are, the quicker we treat, the quicker we heal.
So to sum up what you're saying, it's quite possible that it was very low on the scale of severity, and it probably had just occurred, and therefore it was fairly easy to correct for this chiropractor.
Absolutely.
Good stuff. We have a couple minutes left, but Aaron, do we have another question for the doctor?
We do. We have one from Danny Ocean posted on the Facebook page and asks, how come people see a chiropractor every week and others just see the doctor only for a few visits?
You got 60 seconds to answer this.
Okay, perfect. That is for the exact same reason I just told you. There are patients who come to see me and they've had this problem all their life. So therefore, then I'm managing their problem. If I manage their problem, then I see them once a week, once 2 weeks, once a month. But if it's an acute problem, then we go right through it. We go to a treatment plan. You take care of it. You bring up the strength at the end, and they're done.
Give me an example where you see somebody. Do you see somebody more than one day a week?
Certainly.
Okay.
I have a patient who is currently with a disc bulge.
Yep.
I'm seeing her 3 times a week.
Got it. That's good stuff.
Well, it all depends on the severity of the patient. Every patient's different.
Got it. Okay. We're going to talk more about this. You're going to come back next week, right? We're going to talk more about this. You've been listening to The Fitness Doctor on ESPN.